We are Rottweiler Kennel Angfiero and are happy to help you with more information about the most important hereditary conditions in Rottweilers and what you should pay attention to when looking for a Rottweiler puppy. Rottweiler Kennel Angfiero, the Rottweiler specialist in the Netherlands in the field of Rottweiler breed information. Subscribe now for free to our YouTube channel. Juvenile laryngeal paralysis and polyneuropathy, or JLPP. JLPP is juvenile paralysis of the larynx and polyneuropathy, which is what it means, and the latter means that the nerves are affected in several places on the body. In the case of JLPP, the damage starts with the longest nerve in the body, which, among other things, controls the larynx. The first symptoms are vocal cord paralysis. The dog can no longer produce normal sounds. The vocal cords start to vibrate due to the vibration of the passing air during breathing, which often produces a rattling sound. It is clear that this is at the expense of good breathing. Because the larynx no longer closes properly, the animal regularly chokes on water or food and experiences problems as a result. It is clear that heat and therefore faster breathing causes additional problems. Sufferers of this specific form have symptoms from an early age, and an additional symptom is often seen as a poorly developed eye, a condition that also occurs independently and is known as microphthalmia, too small eye. The eyeball is not sufficiently developed. A form of cataract is often seen. JLPP always results in death and the owner has no choice but to euthanize. There is no cure for this condition. For the specific juvenile form we describe here, the JLPP, the mutation marker has recently been found, which is located on the RAB3-GAP1 gene. Thanks to this marker, a DNA test is also available. So far, this variant only occurs in Rottweilers and Black Russian Terrier, which is partly descended from the Rottweiler. Carriers of this problem have no complaints, but combined with a carrier they can produce sufferers. That is why it was a huge relief for the breeding industry that a test for this problem is now available. The test is offered by most laboratories. Although not yet mandatory, testing is highly recommended so that no more sufferers have to be born. JLPP test designation. N/N equals free. N/JLPP equals carrier. JLPP/JLPP equals sufferer. ED or elbow dysplasia in the Rottweil. What is elbow dysplasia? Elbow dysplasia is a collective name for a number of mainly hereditary disorders of the dog's elbows. These conditions cause pain and therefore lameness in the dog. The disorders already occur in the first year of life, 4 to 12 months. What conditions are covered by elbow dysplasia? Incongruence. When the ulna and the radius do not fit together properly, we speak of incongruence. The incongruence is caused by one bone being too long or too short compared to the other. This can be remedied reasonably well with surgery, although they are not minor operations. The incongruence can cause LPC, LPA, and OCD. LPC. An LPC or Los processus coronoideus is a loose piece of bone from the ulna in the elbow joint. This coronoid process is located at the bottom of the elbow joint. If a dog suffers from an LPC, it is important to remove this loose piece of bone as quickly as possible. Read more about LPC. LPA. The processus anconeus is a bone point of the ulna located at the top of the elbow joint. During the growth phase, the anconeus process should grow attached to the ulna. When this does not happen, it is called an LPA, a Los processus coronoideus. An LPA should also be removed as soon as possible to prevent osteoarthritis formation. OCD. OCD or osteochondrosis dissecans is damage to the cartilage. Especially when a piece of cartilage becomes loose, this can be quite painful for the dog. An OCD should also be removed in the short term to prevent osteoarthritis formation. The removal by means of arthroscopy is preferred. What causes elbow dysplasia? Elbow dysplasia is a multifactorial condition, which means that there are multiple causes. Heredity plays a major role, but trauma, nutrition, and metabolism are also important factors in elbow dysplasia. The degree of inheritance is polygenetic, which means that several genes are involved in the development of elbow dysplasia. That makes selection through breeding so difficult. How is elbow dysplasia diagnosed? Based on the owner's story in the physical examination, elbow dysplasia may be suspected. The diagnosis is ultimately made with the help of X-rays. Attention is paid to the occurrence of the above conditions and whether there is any development of osteoarthritis. The treatment of elbow dysplasia. The treatment of elbow dysplasia depends on the conditions involved and the severity of the clinical symptoms. In general, a more or less drastic operation will have to take place. Arthroscopy is a very valuable method in the diagnosis and treatment of elbow dysplasia when it comes to OCD and LPCs. In addition, important: weight restriction, preventing overload, painkillers/anti-inflammatories, good nutrition, official ED photos. When breeding purebred dogs, it is important to breed as much as possible with dogs that are free of elbow dysplasia. That's why official ED photos are widely used. These are X-rays that are taken and assessed in a number of standard directions. Can I prevent elbow dysplasia? When purchasing, pay particular attention to whether it has been bred from elbow dysplasia-free parents. But please note that having ED-free parents is no guarantee of success, but it does make the chance a lot smaller. If your puppy is an ED-sensitive breed, be careful not to overload and give your puppy good quality food, especially for large breeds. If your Rottweiler is growing too fast in your opinion, please contact your breeder and/or your veterinarian immediately. HD or hip dysplasia in the Rottweiler. What exactly is hip dysplasia? Hip dysplasia, or H/D for short, is a condition of the hips. The hip joint consists of a femoral head, an acetabulum, and the joint capsule. An abnormality in this hip joint can eventually lead to osteoarthritis. We mainly see hip dysplasia in larger dog breeds, but it can also occur in smaller dogs. What causes HD? Hip dysplasia is a so-called multifactorial condition. This means that several factors play a role. Heredity. About 30% of hip dysplasia is a hereditary condition. HD-free parents can have puppies that do develop HD. Conversely, HD-free puppies can also be born from parents with HD. However, the chance of the latter is a lot smaller. It is therefore strongly discouraged to breed dogs that have HD. External factors such as diet and exercise, excess weight, and incorrect use of nutritional supplements can contribute to the development of HD. In addition, excessive exercise such as climbing stairs and jumping is also a factor that should not be underestimated in the development of HD. How is hip dysplasia diagnosed? After a careful examination, the suspicion of hip dysplasia can be made. We only get confirmation through X-rays. A number of things are important when X-raying the hip joint. The shape of the head, the shape of the bowl, the connection of the head in the bowl, the possible presence and severity of osteoarthritis. Deviations from one or more of the above are referred to as HD. What can we do about hip dysplasia? Fortunately, the time when euthanasia was recommended for severe HD is over. Nowadays we can give dogs with HD an excellent pain-free life. In some cases it can even be cured. A good treatment plan is important here. The treatment is based on a number of pillars. 1. Medication. The pain and stiffness in HD are caused by irritation of the joint, comparable to, for example, a football knee. To combat this irritation, long-term anti-inflammatories are prescribed. A frequently heard comment is that giving painkillers would not be good. This is because the dog no longer feels the pain and would then destroy more. This is not correct. There is absolutely no danger of tearing ligaments or joint capsule. 2. Rest, exercise and muscle building. In addition to anti-inflammatories, it is important to give the joint and therefore the dog rest. This means walking on a leash 5 to 6 times a day, for a maximum of 5 minutes each time. How long this must be continued depends on the degree of osteoarthritis and the severity of the symptoms, see diagram. If the complaints have disappeared over time, exercise can be slowly increased, but still on a leash and with the use of anti-inflammatories. The best exercise for a dog with osteoarthritis is straightforward, such as swimming, next to the bike, and grooming. Especially in younger dogs where the poor connection of the joint is the only problem, a good exercise regimen can still create a good joint. 3. Weight restriction. Research has shown that obesity is an important factor in joint problems. The joints are overloaded for years, causing osteoarthritis to slowly build up. For the treatment of osteoarthritis, limiting excess weight is therefore important to slow down further osteoarthritis formation and to promote rest in the joints. If you have made a lot of futile efforts to get your dog to lose weight in the past, it may be advisable to switch to a weight loss diet. Making life easier for a dog with HD. As the owner of a dog with osteoarthritis, you can make life easier for your dog with HD and relieve the burden on the joints. Below you will find some tips. Orthopedic dog cushion. A mattress filled with memory foam ensures a comfortable position while resting and thus relieves the joints. Make sure you choose a pillow that is large enough. Many dog cushions on the market claim to be orthopedic when they only contain a thin layer of memory foam. Gangway. With a dog ramp, the difficult and stressful jump into the car is no longer necessary. With a few practices, your dog will quickly understand how to do this. Make sure that a gangway has a good anti-slip layer. Finally, never increase the movement if the dog is still lame. Even if she experiences a setback while increasing the exercise schedule, never increase the exercise further. It is better to introduce your dog back into exercise until the problems have disappeared again. If the symptoms return during the phasing out of anti-inflammatory drugs, it may be necessary to keep your dog on a low-maintenance dose. In case of doubt and/or insufficient results from the therapy, it is advisable to consult your veterinary clinic. The Rottweiler is very sensitive to these hereditary conditions. These conditions are partly hereditary and partly due to diet and strain on the joints. Avoid high unexpected veterinary costs and take out pet insurance. Thanks for watching. Subscribe now for free to our YouTube channel. Rottweiler Kennel Angfiero. The Rottweiler specialist in the Netherlands in the field of Rottweiler breed information.